Go.
That's a great day to stay.
Okay.
Oh, okay. Our hospital is called Angel Wing Hospital. This is our logo right here. And our motto was, "It's a great day to save lives." Our patient was Maya Robinson. I'm Chioma, I was the physician. Marie was the pharmacist. Kylie was the health coach. Savannah was the manager. Sarah was our nurse. She's not here with us today. And Alicia was our technologist. Okay, so Maya has high blood pressure. She snacks a lot, and with those snacks have a lot of salt in them, so her sodium intake is really high all the time. She is an owner of a floral business, a small floral business. She's a single mom of 2 teenagers. One's 15, one's 18. One is about to graduate high school. She used to smoke, and until 2 years ago, her doctor convinced her to stop smoking, so that was a pretty big change in her life. She usually has a high LDL, which is the bad cholesterol, and the good cholesterol is pretty low in her body. Her blood pressure, systolic and diastolic, is normally pretty high too, and she also needs to watch her BMI. She came into the emergency room with a stroke. Her coworker brought her in at work because she was showing some symptoms, and to get rid of the clot in her brain, they're going to perform surgery. And additional information is that she has no insurance. Strokes are caused by the narrowing, the kind of stroke that Maya had was caused by a narrowing of arteries in her head and neck, which is atherosclerosis. And because of her high fat intake, it caused fat to build up in her arteries, and made it harder for blood to pass through. So that caused a clot in her brain, and then this is how the body is supposed to function, which is arteries supplying the brain tissue with blood, and then this is how her body was affected. She has speech. She has speech problems and physical handicaps, and she will be attending therapy for those as well.
So Maya was taking 3 medications before she was admitted to the hospital. Those were Altace, Roxolin, and Toprol XL. Altace and Toprol were both for high blood pressure, and Roxolin prevents you from burning any excess salt you have in your body. The medication she was prescribed while in the hospital were acetaminophen for pain relief, Lovenox to prevent further blood from clotting, Lipitor to stop production of LDLs, which would keep the more cholesterol from building up in your arteries, Activase, which breaks down blood clots, Plavix, which prevents stroke, and then Botox, which helps you regain movement after a stroke.
When Maya was in the hospital, the physician ordered lab tests, and a lipid panel measures your cholesterol levels, both bad and good. High cholesterol is a major risk factor for stroke, and results indicated she had 250 total cholesterol, which is high because normal is 225 or below. And another test was BMP, which is basic metabolic panel, and it checks the amount of several substances produced by the body, and it checked for glucose, and the glucose she had a high amount of glucose, which is 135, and normal 70 to 99. She had CBC, which measures the number of platelets and red white blood cells in the blood. And CBC results can suggest certain conditions that may or may not be associated with a stroke. Her results said she had a low clots, and she also had coagulation, and it checks the speed at which your blood clots. If there's an irregularity, there's an increased risk of stroke, and abnormal bleeding is abnormal clotting is ischemic, and results indicated that it is decreased, which means there was excessive bleeding. She had a CT scan, which will provide an image of the brain, where the brain clot was, and the blood flow through her brain, and it would help to determine which kind of stroke she had. And it indicated that she had an ischemic stroke. She also had an angiography, and it is to look at the blood vessels. And the physician ordered this to see if there were any clots in the blood vessels, and there were.
Okay, so as the manager, I had to go through and ask everybody what tests were administered or how long they were in places. And I found out it was a lot harder than it seemed to be. We came out to $5,589.18, which after seeing Brittany's doesn't seem that much. But she has to go through a lot of physical therapy, so that's where all of her other procedures come in. Is her physical therapy and her initial surgery, which cost, I believe it was around $27,000 was her surgery. So she has a long recovery, especially for her stroke.
Statistics about strokes is about 25% of people who recover from a stroke have another one within 5 years. And on average, someone in the United States has a stroke every 40 seconds. And the risk of ischemic stroke in current smokers is double that of non-smokers after adjustment for other risk factors. And strokes can and do occur at any age. Nearly 1/4 of strokes occur in people under the age of 65.
So the web links for, the first one is just an overview of what strokes are, and then the second one for treatment just talks about different treatment methods for strokes. The support one is for a support group for people who have strokes, and then prevention is education on preventing strokes. Maya needs to change like a lot of her lifestyle to help her prevent having another stroke. So she needs to eat foods that decrease LDL cholesterol and increase HDL cholesterol, which will stop atherosclerosis. And she needs to increase her daily exercise, which will prevent the development of aneurysms and atherosclerosis. She needs to avoid stressful situations because those can cause aneurysms, and she already has increased risk of bleeding. And she needs to avoid unhealthy habits such as smoking or drinking too much alcohol, because those can increase your chances of getting a stroke.
These are just kind of some goals that Maya should try and achieve in her road to recovery. Later on in the presentation, we give Maya a nutrition plan and an exercise plan, but it's just kind of an overview. Just follow the nutrition plan that we gave you, avoid snacking on junk food and eating high sodium foods. Try to exercise at least 4 days a week, following the fitness plan that we gave you. Avoid smoking, and make sure you check your blood pressure, because before she came into the hospital, the report said that she was pretty negligent about that. And then activity, just try and do small things like take the stairs to the elevator, or maybe try getting like a device that tracks your steps that can maybe motivate you to stay active.
Calories per day. She was having way too much. She had over 2,000, so we bumped her down Healthy things to eat for people that have strokes is definitely fish. Have that at least twice a week, and then like low-fat dairy products, lots of fruits and vegetables and whole grain. Her limitation, she has to have less than 1,500 milligrams of sodium a day, because that's one of the main keys that led her to having a stroke. And she needs to have small serving sizes with a variety of foods. Finding meal plans for her is a little difficult because you have to have low sodium, but she also has to get her calories up, because it's hard to find two things that have low or high calories and low sodium. But it's a pretty good diet. That's the same thing.
This is Maya's exercise plan to help her get rid of like the fat and help her keep the fat levels in her cholesterol and fat levels in her body at a minimum. We said that she should exercise, she should do cardiovascular exercise at least 5 days a week. And that can be, and when she starts, she can gradually increase it to an intensity that she can handle. And that would be mainly walking or biking. And then strength, and that would be to rebuild any muscle damage that she had, that she got from the stroke. And that was 3 days a week. And then on the days that she does cardio work and strength training on the same day, she should take it easy on both. And then intensity the same way as cardio. Start easy and then grow from there. And then that can include weightlifting, resistance, like little resistance machine, and then using elastic bands and things like that.
Okay, so a stroke occurs when blood leaks into the brain or when an artery is blocked by a clot or arteriosclerosis and blood cannot reach the brain cells. Symptoms are difficulty with movement of certain muscles, blurry vision, slurred speech, lack of balance, fatigue, reduced sense of touch, numbness or weakness of limbs, difficulty swallowing, difficulty understanding others, headaches. Some causes. Strokes can be caused by any aneurysm breaking and leaking blood into the brain, arteriosclerosis blocking arteries, or blood clots blocking arteries. And her diagnosis was an ischemic stroke. Her treatment, medications that break up blood clots and medications that stop production of LDL cholesterol. The short-term impact was slurred speech, sleep problems, difficulty finding the right words and understanding, and the long-term effect, she had speech and language issues, swallowing, memory loss, inability to pay attention to visual fields, emotional functioning, personality changes, depression, and paralysis. And then the prevention, we put on our exercise plan, a diet plan, and just staying active. I think that's our last slide.